Okay, namaste. Good evening, everyone. Uh, okay, welcome. Okay, 1 second. Let's see how many of you are there because this is a candid sort of interview. Hi, Manish. Manish, Dr. Manish, good morning. Benjamin, good morning. Good evening. This is not a routine sort of live stream, it's something different. It's not about the topics which we are uh, which we will discuss. Good evening, Dr. Mohammed. I don't know whether it's doctor or something, doctor, nurse, paramedics, but it's that's the way it is. So today we'll be discussing something about the channel updates. Good evening, Dr. Sujit. So this will be some 30-40 minutes live stream. Good evening, Dr. Farooq, Bhushan. Many are there, so a lot of people now are joining. So I have, if you can see, I have worked this almost long list for today on 10 points we'll discuss and then we'll finalize. uh, Dr. Ashu, um, good evening. So we'll start now. The first thing, it will be interactive session so that you can post in the comment sections what we'll discussing, and I'll take note down your suggestions so that we can implement on the channel. The first thing which you have noticed is the two logos which are there. One is on my right side and one on my left side is uh, the ICU. Mohammed, few days back I met him. I hope it was a good dream. Okay, Dr. Mishra. So the first thing which you have noticed is, oh, my dear friend Chirag, Dr. Chirag again. It's always nice to see you. You are a real motivation for all those medical people who want to help the community. Nice to see you. Nice to see you again. Many thanks for joining. So what we'll do today, we'll try to have Chirag once on our channel. He's a big fellow, so it will not be easy to bring him on the channel. But in future, we'll try to bring him on the broadcast, or we'll do some interview with him. I'm also a big fan of him. If he agrees, we'll do this because he's busy, very much busy nowadays. So again, coming to the point, if I keep on posting like this, we'll not be able to finish in next 40-50 minutes. But today, the two first thing you must have noticed that we have two logos on my screen, one on the right side and one on the left side. One is of the ICU channel. Earlier it was written ICU.in sharing what's critical. Now we have modified a little bit for the ICU channel. Sharing what's critical, and also we are working on the logo of ESBICM because bedside intensive care, it's what we teach, so BI is there. Thank you, Dr. Chirag, for accepting. We'll come back to you, we'll discuss later on after this stream. Okay, so BI, you can see that BI is highlighted, so it stands for bedside intensive care, so ESBICM. We're working on the logo, almost it's finalized, so I want to share with you if you can if you can provide your feedback on this. Now the first question which I want to ask you all, the first thing which I want to ask you all, we are providing two type of content on the channel. One is the YouTube shorts, the 1 minute videos which we are providing almost daily. We are trying to post them. If not daily, at least in 2 days we try to post them. There was a gap in between. And the one is long form videos. So do you want any suggestion for the shorts, because we are providing daily, so it's fair enough. I think the frequency is fair enough. But for long form videos which are 20-30 minutes, 1 hour video, how many videos you need, the frequency of videos you need in a week? You need a weekly, twice week, or what you call for a month. What it should be the frequency, on which day you will prefer on a particular time, whether it should come on Saturday night or Friday night or on the Sunday mornings. So first thing, how much we should be the frequency of the videos, because I don't want to bombardment with all the videos at a time. So just give me an idea how much videos, one video, two video, sort of long videos you want in a week, and then we'll discuss the type of those. But how much should be the frequency? One or two videos a week, or one video a week, that too on Friday or Saturday night or Sunday morning? Do give me some idea. Do give me some idea in the chat box. Weekly, Muhammad is saying weekly. Anyone else? Any have suggestions? We have 23 people there. Weekly is the thing, twice per week. Okay. Mr. Tong said twice per week. Okay. Need updates on critically, including journal reading. One very good suggestion. This is came in. I'm noting it down. The first suggestion I think, journal updates. This is very much important. Or latest article. Latest article. Okay. One weekly, one twice a week is Saturday night or Sunday morning will be good. One or two with a week. The most one long video per week, one a two video per week. Rishi Karan at least twice, and Saturday night or Sunday morning would be better. Twice per week, one live class per week. So we'll come to that. So most of you are agreeing on one or two videos per week. That is the one thing. Now most, and the timing, I think it's Saturday night or Friday night or Sunday morning or Saturday night would be better. So give me so Friday night, Saturday night or Sunday morning, which would be better? So I'm again asking. So we have decided that one or two long videos per week, at least once a week, it's a must. Second, which would be the best time to post such videos? Friday night, Saturday night in a week, or Sunday morning? Any suggestion on this? This is about long videos. So what I'll do, I'll keep writing here so that we get to know what is happening. 1 to 2 long video per week. That's the thing we have decided. So one or two long video week we have decided. This is the first thing we have decided. Secondly, just hold on. Okay. Sorry, the comment was not Saturday night once weekly, Saturday night, Thursday, Saturday night, Saturday. So most of the people are asking, saying that preferably, Saturday night. Sorry. I'm writing it down so that we can understand what we are doing. So preferably Saturday night. Long video, one weekdays, Friday or Saturday night. So shorts will provide almost daily. We try to make it on short topics which we keep in the night. So now that's the first thing we have decided. One video per week, preferably Saturday night. Second, journal updates. Now, out of these two videos per week, would it be what type of content you want? What type of content you want? I was thinking of one live class and one recorded video. This is my suggestion, that one live class and one means live class like we are interacting right now. and one will be recorded core topic, very important topic for the ICU. That's my suggestion. Any suggestion of yours? This is a night session. Sunday let us have family time. Better Saturday night. Saturday, in fact, Friday night could also be there. That's Friday or Saturday night. Saturday night. The other thing was which was asking is, out of the two videos if I post, then one could be a core video, which is a recorded one, and the one will be on uh, live class. Again, this is a very good suggestion by Cute Boy. Resource limited ICU management. Note it down. Resource. This is very very important. That's the purpose of the channel, to provide mm, resource limited ICU management. This is a fantastic suggestion by Dr. Sujit. Live class on the same core topic that comes before or after the core lecture. This is something which we can take off. Like we have recorded a video on stroke. So once the stroke video is recorded and it's on the channel, then we can have a live class and discussion for clarifying of the doubts on that. Would this be wise? This is this is a very good idea, that if we post a recorded video, the live stream could be on the same topic. This will help to clarify those doubts, and one can go through the previous video to listen to the core topic and then can clarify on those doubts. This is very fantastic, Dr. Sujit. I really love this idea. So one core topic and live stream on same topic. I'm noting it down. Same topic that week. Yes, live class on posted. Live class, actually, whenever we take a live stream, live class, whenever we will take live class, it gets recorded and posted, but it's unedited. We don't edit it. Means if it can be 30 minutes, it can be 40 minutes, it can be 1 hour, it can be 2 hours. So we don't edit. Like right now, I'm talking to you, it is there. It will be like that only. So that's the thing. Second, okay. Mm, we'll work on that. We'll work on that. Live class can be posted, and okay. We can clear doubts, but topic should be different, sir. Uh, ठीक है. Now, one more thing regarding the live stream. What I was thinking is that, listen to this carefully. What I was thinking, that in the live classes on the YouTube, you have the option only to chat with the students or chat with the members who are watching it. I was thinking of, on Zoom there is a limit for some 90 100 people they can join and they can interact. So what I was thinking, in a live class, for those who have enrolled on the ESBICM membership form, which is free for all healthcare people, we can provide access to limited members, some 80 90 members, which we can discuss, have a discussion on the Zoom, and they can interact with us, and the rest of the members can have a live chat. Would it be fine if we allow certain people to interact live with us, one to one, during, means we have a live stream, side by side Zoom is going on, we are discussing on the Zoom and interacting with the YouTube people, and that on the chat box, we can take other questions also. MO Ashu. Oh, so you are a staff who is working the rural ICU. Very nice to have you. Very nice to have you. If our channel is reaching there, that's the purpose, to help you out, help the people who are there in the rural environment where the resource limited. As that is fine. So what I have discussed, in live stream we can have Zoom collaboration. How one? Okay, Zoom collaboration in live stream. Okay, Now, as our channel is growing, the problem is ki there are lots of videos on the channel. It's very difficult to browse those channel. So what we have decided is we will be dividing all those videos into 6 7 playlists. So I will enumerating those playlists, the type of playlist in which we'll organize all the content. If you have any other suggestion, to post. One will be the core topics in the ICU, like mechanical ventilation, um, like your electrolyte imbalance, like your ECGs, like antibiotics. So these will be in your core topic. Second playlist will be frequent ICU conditions, like what are the common ICU conditions. Have MI, you have stroke, you have heart failure, you have renal failure, you patient receive pancreatitis, cirrhosis, hepatic NCAF. So 20 topics which are very frequent in the ICUs. We can have playlist on that. Third will be ICU case discussion. These are the case discussion which are difficult or interesting cases, which like myasthenia or GBS, which come up at random intervals. Like now, is the Vibrio cholera is coming. We can post those in the ICU case discussion, like the uncut version which we used to post before. So this will be helpful. Fourth is the untouched topics. In the untouched topics in the ICU, like how to deal with the attendants, how to train your junior resident, how to have a interaction with the nursing staff, how to manage a bed crisis situation. Like all these will, which are the untouched. Like one of the very one of the very good suggestions, which like resource limited ICU, how to manage in resource limited area. One playlist is like let the playlist as a chapters in the textbook. That will be very difficult actually. Textbook covers a lot of things, which to put them all in a practical manner, it's not. But we are doing it like core topics, frequently common conditions, case discussion, untouched topics. Then will be live stream playlist, and one playlist will be of question and answers asked by the members. Now on the in the comments of the channel, we are receiving in the comments receiving channel comment section, lot of questions are coming. I keep browsing them, but it's not possible at times to respond to them immediately. At times I need to read them, I can at times I can explain them, but to write that much descriptive thing in the comments, it becomes very difficult. So what I'm thinking is, every week I will have some question and answers questions, review all the questions comments which are there in the comments, and then make a short and 10 minutes video, and we'll answer those questions in that video. So there will be Q&A master list, and there will be one more list, is practical issues in the ICU, which doesn't fit in everything, miscellaneous and practical issues in the ICU. So this way we will sort the playlist on the channel. In coming 1 or 2 months, you will see, in coming in fact 1 month, you will see the all the content get arranged in that manner. Okay, one more suggestion by Muhammad is that the recorded session should not be more than 30 minutes. We'll try to do that, but at times it takes time. But what we'll do is we divide the chapters in the video, so that whoever wants can go there. Sorry. Now, two is new playlist. New playlist. Okay. Exam oriented questions. Okay. Now, by looking at the chat box, what I'm seeing is, just one which is very important is, there are a lot of requests which are coming on the comment section, and in the comment section, what is happening? The request which is made by the students or the channel members get missed. So will be coming up a form, Google form, in which you can post your video. So I will have a list of videos on the back end, that these are the suggested list which are there, and we have to make videos on them. Okay. Form Google for request. requested videos. One because have asked, sir, one playlist could be rarely encountered anomaly. We can think on that. Rarely encountered. We will be post. We try to post in this ICU case discussions. We'll try to do that. But I have noted down rarely encountered conditions. So now there will be a form. I'm removing this. I will making a form for your video request list so that you can submit either your topic suggestion or specific question related to that topic. So on the background, I will be having those questions. So I also aware that you people wanted those topics. Okay. Now Rishi Kiran has a very good suggestion procedures. Now the problem with the Rishikaran that the procedure is in procedure we need to show the patient. We need to what you call show some part of the patient, which becomes very difficult on the YouTube. Uh, how we'll do that? Because is it okay if we are showing how to put a central line? Is it okay how to put an artery line or ICD or lumbar puncture on the YouTube? I don't know whether it will comfortable or not. But yes, I have noted down. And one good request is by this cute boys. You have a lot of good suggestions. Drugs and instruments, very important. Thank you for reminding this because drugs is something which needs to be mastered in ICU. So we'll make a list of common drugs in the ICU and then can what are the side effects and then we can make on this. Okay. Okay. Now the format of the videos. Now the format of the videos. Which format? You have four formats. One is your PPT type presentation, like on the long videos. Second is explaining sort of videos in which there is a minimal graphic. Third will be a chalkboard like the whiteboard which is there at the back, explaining. And the fifth is a podcast sort of thing. Just I'm explaining. Oh, finally I got your name, Dr. Sunil. Thank you, Dr. Sunil. You have lot of good suggestions. Okay. Protocols we'll take in this protocols we'll take in this core topics or whatever topic we'll do. Okay. So playlist suggested. I have added down the procedure one, really and count and condition, and third is drugs and instruments. That is a good one. Now, which format you people want? In which format you will prefer? Whether you want in a PPT sort of format, there's a PPT I'm explaining, or I'm talking most of the time and explaining with minimal graphics, or you want a chalkboard type of pattern. Which will you prefer? Or the fourth one is podcast sort of. I'm just talking from wherever I am. So, which format you people would love? Which will be more useful to you? Yes, these graphs will put in this core topics. When graphs in ICU. Very nice. Talking sort of. Okay. So Dr. Sunil, you have put both the things. Talking with chalk and board, both. Chalk and board. Chalk and board and teaching. So this one sort of you people are comfortable with talking. But the problem is like on those things, I cannot show your blood gas, I cannot show you X-ray, I cannot show you the CT. For that, I need something on the screen. We can do that. It's a combination of something. Talking in shortboard, the older tradition, you can improvise when you have doubts. That way, yes. Board core topics. Yeah, that is a good one, Rishikiran. Chalk and board type of core topics in case discussions, drugs and procedure. This is very good one. This is a nice thing. So I am noting it down. So for core topics, chalk and board, and for others, talking or screen sort of. Very nice. Explanation part in chalkboard demonstration, like in living teaching, talking. Okay. Oh, Benjamin also saying talking and chalkboard. Very nice. Benjamin is my critical care fellow. He is will undergoing exam. That's why he's joined live stream. Otherwise, he would not have joined. Shrikant is a good idea. iPad with PPT so that we can have best of the both worlds. That also can be tried. But the problem with that is interaction becomes a little bit cumbersome in with iPad sort of. I'll try to get this. I'll try to get this one corrected. iPad with PPT. Okay. Now there is some update regarding the social handle platform. This is something a topic of discussion with our team members. A lot of time we had discussion on them. So I'm noting it down. I'm so that everybody is comfort. On YouTube there is YouTube, which is our core. Sorry. Uh, then we have Instagram. Then we have Twitter. Then we have forums. Then we have Telegram. One more. Spotify for podcast. Now I need suggestions of you all. Sorry, Instagram is I have not. First, let me give you my point of view. YouTube is our core in which everybody is comfortable, so that's the point. Q&A, the critical care. Okay, Chronicles Q&A. We'll definitely take that. Now on social media platforms, YouTube will be is our main online platform in which we are providing. Okay, WhatsApp. Practically speaking, I have listed down all this platform because we will not be able to cover up all the platforms. We want to delete some platforms from there. So which will be our core will be YouTube, on which we'll provide all the lectures, all the playlists which are doing. Second, Instagram, we get a lot of requests for Instagram. We get a request, but the problem with Instagram is I don't think it is used for academics, though many have suggested different channels and different creators that it should be used for creating this content. But the problem is there is no searching on Instagram. Also, the moment you get in the Instagram, you end up seeing 10, 15, 20 different reels. So I'm not in favor of Instagram. Twitter, still I am not comfortable. For that matter, threads which is coming up, I am not very comfortable because it get lost. The thing you post, it get lost. The only thing is useful is we can post our updates, short updates which are coming, day to day small updates which we are coming. We can use that for that, but not for teaching, but for updates. Now between forums and Telegram, what is happening on our I tell you what is the story. On Telegram, what happened? We created two channels. One is the ICU channel by ESBICM, and the other one is the ESBICM group channel. Now, what is happening? It's like a WhatsApp something. WhatsApp or Telegram are more or less similar. Now there are so many questions. So many questions are there. So many questions are there on the group Telegram group, that the first question I miss, it keep on scrolling, it keeps on scrolling, I'm not able to answer those daily or sorry, in a timely fashion. So what I'll trying to do is, on the Telegram we'll keep continue with the Telegram channel, which is the ICU channel by, in that I can post things in my voice messages, what I want to tell you in suppose in the ICU or in the home I'm reading something, I find something very interesting, and during that period I want to share with you. So what I can do is, I just record something and I can share with you all on the Telegram or on the WhatsApp. This will be very useful for me, so that nothing is missed. Suppose I'm reading a textbook and I came across a very important fact, and I'm not in a position to record a video, but at least I need some place where I can share. Suppose it's a 2-3 minute thing and I cannot post a short on that. So what I can do is, I can give you a voice message there on the Telegram, and then when WhatsApp will start its channel, I will definitely jump into it. But right now, Telegram is a good thing. So we'll continue with the Telegram, but the discussion part will not be taken place on Telegram. For anyone who want to discuss things, the forums will be a platform for them. You have to, or you can discuss on icu.in/forums, so that every answer is segregated topic wise, and I can, whenever I get time in a day or two, I can reply to them in a detailed manner after checking the facts or understanding the question. So for discussion, for two-way interaction, only icu.in/forums will be there, and you can go on icu.in and there will be forum. Second, if I feel useful, on the homepage itself there will be forum. Right now you need to jump on the forums, but I will try, if I, if possible, I can move on the front page itself. So YouTube, sorry, YouTube, yes, forums, I'm not writing down in front of them for discussions. Telegram for voice messages and information info. Okay. Now Twitter, I can't. Spotify, some people give suggestion that you should post podcast, but it will be too much for at this stage, so I'm not using Spotify right now. Not at the moment. Not at the moment. Now, if WhatsApp also comes up with the channel facility, will it will be used like Telegram one. So that's more or less same. Now, give me your comment on Instagram, whether you people need an account of ours on Instagram for, not for, I will not use it for academic. It will be a very casual sort of account, which means it will have some sort of humor. It will have some sort of light moments in the ICU, so that we can have, because we need to bring humor from our day to day activity in ICU itself. So that's where something we can post. If you want, we can continue with Instagram. If you want, maybe we have deleted it, but if you want, we can do that light things. But on WhatsApp, the number of people which can join are limited. On for Telegram, there are, you can accommodate lot of people, so that's why. No for Instagram. Okay, no for Instagram. Anybody voting in favor of Instagram with justification? YouTube will be a lead platform. Second will be your forums. Third for voice messages, Telegram. Yes, Instagram deviates us from the main topic, and there is no search facility where you can dive. In fact, when I post something on Instagram, it takes 15 minutes of mine to see some other reels also. Yes, but many of my ICU residents and some of them, they were saying like, just like you said that, ki it can be for lighter moments. In the ICU, we are tired or something. We'll consider, but I think majority of you are not happy with comfortable with Insta. It deviates. No Instagram. Yeah, I am of the same view. Because our learning is comfortable with YouTube. For discussion, you can use forums. And the third, for my on spot something which I need to share, some textbook image or some voice messages, Telegram, or in future WhatsApp is fine. So we'll continue with this. Okay. So fine. Will not waste much time more on this. That's the thing. Okay. Now I'm deleting this. Huh. Coming to very important point. Very important point. There are a lot of comments which I receive on the channel in the comment section. Usually I try to reply, or my team tries to reply to those comments. But what's the best way of replying to those comments? For small comments, I usually reply their own sense, but there are certain comments which need explanation. There is genuinely a doubt which needs to be clarified. It is not possible at times in 1 minute, and it's not possible time for me to post 2 3 minute video just like that on the channel. So what I'm trying is, my suggestion would be, in a week we'll go through all the comments which are there relevant, and then we can post a video of 10 to 15 minutes explaining those doubts of different members. If you people have any more suggestion in what way you want to know the answer, or what way you want we should reply to your comments, please tell me in the chat box how we should reply to your comments. Just there itself in the comments, or in a video, separate video, by collecting few of the comments. Separate day for question and answers. Okay. So come up with your suggestion how we should reply to your comments. Separate video explanation, just not the source of the, yeah, that's I will maintain. I will separate, I will explain them in my way. So we can have Sunday morning or something which is a casual attitude over a cup of tea, where I am seeing your reading your comments and then explaining them, which requires a detailed thing. So I'll post a separate form in a 2 3 days, so that there you can ask certain specific questions, or you can have a request for a topic, so that I'll have something in the background where I will not miss those comments, miss the section. Yes, Dr. Chinmoy, separate video. So what will happen in the week? How many comments gets collected? We'll reply to them. Okay. So I think that's all I wanted to discuss. Okay. One more announcement sort of thing is there. Uh, uh, how to tell you this? I have a lot of requests for personal classes. See, because the ESBICM is open to all, whatever I know, I share on the channel so that everybody can listen to it. And still, there are some students who want to have a detailed discussion on certain topics. So I am thinking of conducting personal classes on Zoom online from anywhere across the world, but it will be limited for 50-60 people at a time, out of which 50% will be limited to India, and then other seats we can take from other countries also. If you have a group of people in your hospital like 10-15 people who wants to listen for a particular topic, who wants to understand particular, suppose like somebody from I forget the name of that memo, who is working in somewhere separate in a rural area, if he has some 10 people who wants to learn mechanical ventilation or want to learn antibiotics, or suppose somebody in the ICU are struggling for the procedure, or some on a receiving some trauma patient frequently, they want to uh, have a class on that, you can request us, and then we'll have a separate, it will not be on YouTube at that moment, it will be on Zoom one to one, and then if required we can post it on a Zoom, post it on the YouTube at a later on time. Because in live classes there are certain things which we cannot post on the channel, there are certain practical issues which we cannot post on the channel, but it will be good to interact them and we understand the working of there, so that as a whole we can improve the system. So I hope that it will come up with a name of critical care classes, and we'll be sharing the details soon. Dr. Sunil, the problem with is though number in Zoom there is a limit for 100 people, and I don't have any other platform on which I can have more people. Only on the YouTube live stream, like you people are there, in that anyone can interact, but only in the chat box they can interact, not in the talking term. But that Zoom meeting can be edited and posted. That is one option is there. We can edit that and then can post. While the live stream cannot be edited, so that is different story. Okay, so that was a short session. Any more suggestion you want to? So what we have discussed is the short and long form content. Shorts will be usually daily, long form usually 1 or 2 videos. One will be a core topic and the other can be live discussion on also. Live stream we'll try with Zoom, then we'll reshuffle the playlist. Question answers we'll try to post in a question answer sort of pattern. In terms of how the video should be moved, so chalkboard for the core topics and discussion with a talking one more, but we'll figure out a chalkboard. I don't and in social media platform YouTube, Telegram and forums to continue. We will be closing one of the groups on the Telegram in which their discussion is going on, so that for that only you need to visit ICU.in on which there is a forum. Instagram there is a no, if required only the casual part. No for podcast as of now. For video request and question request, you'll have separate Google form. And procedure and drugs needs to be taken care of. Journal updates, I will have trials also in it. Resource limited ICU management. And that's it. Sham, thank you. I do Telegram have a live class. I don't know if it is there is possible. I need to figure out. I have noted down Telegram live class number. Okay, so that's all for today, and soon these all updates will be posted, and we'll keep you updated. Okay, so he's MO Ashu is I'm working in the rural area here nearby, no CT scan and MRI and no culture. How to manage in the neuro patient at ICU? We'll discuss that in a resource limited area. What to do? Most of the time you need to refer such patients, but basic primary care we can provide at such centers. We'll do that. So that's all for tonight. If you anyone, I'll be there for 2, 3, 4 minutes. Uh, if you have any more suggestion, you can provide me. I'll wait for 1 or 2 minutes so that. Thank you. Well, thank you. Everybody is the best. We are trying our best. We may or may not be the best, but we are trying our best to put all the content on the platform so that everybody can understand and listen to all those things. Because intensive care, it's not an easy branch which we get to know during our graduation days or even for the post graduation. PICU, okay, pediatric care. Dr. Muhammad, I need to go through that because that's not my core. Though we have 1 or 2 pediatric intensivists with us, but they are very busy in managing. I tried at time to bring them on the platform, but pediatric. But I'll try to find out some channels for you. Okay. For nurses, we can have a separate list also. Actually, everything which is there in the videos, it should be seen by uh, it should be seen by both the doctors and nurses. There is nothing separate sort of thing, but some core nursing topics are there. uh, I'll try nursing because everything on the channel is for doctors and nurses, those who are working in the ICU. It usually, I don't feel there is something stroke every nurse should know, MI every nurse should know, how to give RT feed, how to take care of the bed sores every doctor should know, how to take care of the central line care bundles every doctor should know, how to manage the ventilator everybody should to know. So for me, the doctors and nurses part are more or less same. In the intensive care, at least everybody should know everything, so that way we'll take care. So okay, thank you. If you have any more suggestion on this live stream video, you can post at the even if the stream ends, and we'll love to take your suggestion, and I'll be working on all those suggestions which I have received. And thank you for your feedback, and I hope some of the comments, if you have any suggestions on our this new logos on the channel, if some you can comment on this the new logos, this will also be useful for us because our designer and team give a lot of thought in bringing things. So we'll for time being, I'm confirming, reassuring that we will only have 3 platforms. One is our YouTube, second is your Telegram for voice message, and third is for the ICU.in forums, our website on which there is a forum you can discuss. Only on these 3 things, these 3 platforms will be working. That's it. Thank you, Benjamin, for staying with us till 10:18. It's really nice to see you. Namaste. Thank you. Do keep your post suggestions in the comments of this. Thank you.